Logo fades into view. New York Association on Independent Living.
Thank you to our 2022 webinar series sponsor, Waymo.
Great. Thanks, Alex. And thanks so much for having us here to present on this really exciting new group that's forming. So yeah, I am here. We'll do some introductions, my colleague Arin and I in a quick minute. But we're going to be talking about DisDATA, Disability Advocates Taking Action, and hope to provide you with, if I can change my slide, hope that, you'll leave this webinar presentation knowing a little bit more about the group that's formed and how you can get involved. Learn about some of the stuff that we've been doing over the last year or so, and hopefully start thinking a little bit differently about data and feeling maybe more comfortable if you want to participate in this group in kind of some data advocacy. So my name is Lillie Greiman. Like I said, I use she, her pronouns. I'm a white woman in my 30s wearing glasses with kind of brown hair. And I am a project director at the Research and Training Center on Disability in Rural Communities at the University of Montana. And my background is in geography. I love data. I love maps. And so we're really excited to talk about this as well. And I also have some background as an advocate and am passionate about advocacy and activism, though don't always get to do it in my role as a federally funded researcher. So there's a line to walk there. I'm going to let Arin, I guess, introduce himself really quickly, and then we'll get started.
Hey, everybody. I'm excited to be here. My name is Arin. I use he, him pronouns. I'm a white male in my 20s. I have short brown hair and a short brown beard, standing in a pretty minimalist office. I work closely with Lillie as a research associate at the Rural Research and Training Center, RTC Rural. And similar to Lillie, I'm trained as a geographer. And so it's been super fun to sort of apply our research to this advocacy network and get some information out and kind of talk to people and find out about what the research needs are. And yeah, again, excited to be here today.
Great. So I think that the way we'll do this is we'll go through all of our slides. We don't have too many, share all this information, look at some maps. So that'll be really fun. Although they're pretty depressing. So it's like fun and depressing. And then we'll leave some space at the end to hopefully have a discussion. So feel free to put questions in the Q&A. We can try to look at the chat too. That might be a little harder. And then I think Alex said we can unmute. So hopefully, and I think also I'll be sure to try to share this presentation out. Maybe Alex can email it out to everyone afterwards. So we'll get it to folks. So awesome. So what is DisDATA? So DisDATA formed in the fall of 2020 in response to the deaths of disabled people over the course of the COVID-19 pandemic, and particularly the deaths that we've seen in institutions and other congregate settings, such as prisons, other hospitals, group homes, etc. And really our national inability early on and continuing to count those lives and prevent their loss exposes a long-standing issue that disabled people are missing from data design, collection, and decision-making, that a lot of the times in terms of disability data, it's not nothing about us without us. It's a whole bunch of decisions without us. And that's important to recognize. But really, we believe this group of us, we're about 50 or so strong right now, that this problem is preventable through collective action. And we are really cross disability. We're a national kind of collaborative building this network, still very loosely defined. But really, we are committed to making data about disability equitable, actionable, and transparent. And so who are we? I think first and foremost, we're a community of people with shared values about justice, equity, and compassion. But we represent a lot of different fields and backgrounds. So we're a group of advocates and activists, service providers, researchers, community members, both with and without disabilities. And really our goal is to work in solidarity with disabled people, disability-led organizations, and other groups of people who are systematically marginalized due to structural ableism and racism, and to collect the data that we need to advocate for and affect change. So why data? I think really there is power in data, and that is maybe problematic, right? That is maybe representative of a broader system that values numbers over people. But that is a little bit of the world that we live in. Data determines who gets represented and how. I think New York is a good example of this, in that someone can correct me, that I think New York lost a state representative maybe in the recent census, which is actually a really excellent illustration of who gets represented and why in how data gets collected. It also really, you know, who asks the questions and why is another incredibly important part of data. Data systems can also be used to marginalize, exclude, as much as they can be used to include and understand. And I think historically we've seen data systems marginalizing people, particularly people with disabilities, particularly in the way that disability has historically been conceptualized via the medical model and the conflation of disability and health. And I'd love to talk a little bit more about that too. But really, there are kind of, we have this kind of statement here, there are three kinds of data: good data, bad data, no data. And that all of these data groups matter, right? Understanding what data is out there, what data is good quality, data that asks good questions, that represents, you know, authentically people, I guess. And then there's bad data that asks terrible questions and presents itself as, you know, fact. And then there's no data, which matters just as much, what data isn't being collected. And so really what we've seen is that disabled people are made invisible across federal policy through the lack of data collection and representation. And that's kind of resulted in a disability data inequity. And this is particularly true in congregate settings where data is really hard to access, where measures are collected differently, disability is defined differently if asked at all. And then also in intersectional spaces and representing people with disabilities who are also people of color, also have different lived experiences, or, you know, are geographically located in rural areas, for example. And so we really are seeking data equity, and we want to come together primarily to improve disability representation across all levels of data collection. So ensure that people with disabilities are represented in how questions are asked, how surveys are implemented, and how and which data are used to inform policy. So what do we do? I mean, we kind of did a lot frantically in the last year. We really came together organically. It was, I think I have to credit Tom Olin. Some folks are probably familiar with Tom for reaching out just with a data technical assistance question back early in the pandemic around transition. And it kind of boomed into an ever expanding listserv of people that were starting to come together that really wanted to talk about this and specifically start looking at data in around COVID and congregate settings. And then finding opportunities through that group to start drafting statements and running some analyses and getting some information out. So we have had the opportunity to advocate for disability data representation and presented at the United Nations regional consultation of the Committee on the Rights of Persons with Disability, and presented public comments also to the Biden-Harris Health Equity Task Force. and we're able to be there and be that voice in when we're talking about health equity and recognizing that people in congregate settings are people with disabilities, and really emphasizing that congregate settings were incredibly dangerous places for people with disabilities to be at all times, but particularly over the last few years. Couple years, I suppose. So we've also analyzed data to support local and national advocacy efforts. So we worked with the Center of for Disease Control and Centers for Medicare and Medicaid Services data set, COVID-19 data set, to do a national analysis of COVID-19 cases and deaths in nursing home. We've developed, we partnered with members of DisDATA, partnered with RTC to put out a research brief to communicate that impact, and then have created some dynamic data visualizations at both the national and the state level to really illustrate what is going on, and to create a tool or a graphic that folks can use to communicate with policymakers. So I'm going to turn it over to Arin, and I will try to run, and I'll see if I can get this to run. So I'll mute myself and let Arin talk.
Thanks. Yeah, I think this will just play in the background. I'm going to read a quick description of it. This is a video graphic that illustrates the change in weekly COVID-19 cases in CMS, those Centers for Medicare and Medicaid Service Facilities, by county over a period of 10 weeks from July 5th to September 19th, 2021. Counties are shaded from white to light orange to red on a scale from 0 to 797. White or light orange counties have fewer cases and red counties have more cases. Counties for which we don't have data or where there are no nursing facilities are shaded gray. This first map represents, or the first map on this video represents the week of July 5th, and a majority of counties across the US are shaded white or light orange with 0 or 1 cases. Over time, clusters of counties all across the country grow progressively darker until the final week of September 13th, which shows considerably more cases in dark red, with red counties in every state, and some counties reaching levels of 797 cases. Over the course of these 10 weeks, a total of 36,535 cases were reported in nursing facilities across the country. And I think we'll show one more national map of COVID deaths. So Lillie, could you go to the next slide, please? Thanks. This is a similar style graphic showing change in weekly COVID-19 deaths in CMS nursing facilities by county over the same period from July 5th to September 19th, 2021. Counties are shaded again from white to light orange to red. This time the scale is 0 to 59. Again, the first week, counties are shaded white and light orange with few deaths, and then it grows progressively to where the country is dark red, with some counties having 59 new weekly deaths. Over the total course of these 10 weeks, there was 3,394 COVID-19 deaths in nursing homes, at least as they were reported. This time period was kind of picked to capture the Delta variant. So we just recently did some new kind of data analyses on the Omicron, which we'll get to. But first, I do want to talk a little bit more about this data set that we're using. So Lillie mentioned it's from the Centers of Medicaid and Medicare Services COVID data set, which is partnered with the CDC, which is kind of an interesting data set because you do have COVID cases and deaths for residents and staffs that you could look at. Here we're looking at resident deaths in New York. But this data set is closely linked to other CMS data sets, which have something like variables such as star ratings or chain affiliation or number of complaints or number of beds. So there's a lot of opportunity for analysis here. Looking at this map, this is just showing you locations of CMS facilities in New York. the gradient of the dots is showing COVID-19 deaths as of January 9th, 2022. I think the cutoff date for that was January 16th, 2022, so not too long ago. As a note, I think that's Hamilton County, and there's one other county in New York that don't have data reporting, which I found kind of surprising. I thought there was, is it Hamilton County where Colgate is? I thought there was a college town. I thought maybe there'd be one there. Could you go to the next slide, Lily? So this is, again, another graphic showing COVID resident cases from December 5th to 2021 to January 16th, 2022. We picked this time frame because it kind of captures the Omicron variant. The first week is December 5th. As the graphic moves on, you see that the state goes from white and light orange to red and dark red, with some counties experiencing caseloads of 939. Over the course of this period, there were a total of about 44,000 cases reported in these nursing home facilities in New York since the start of the pandemic. Next slide, please. This is, again, a similar graphic showing deaths in CMS nursing home facilities for residents from December 5th, 2021 to January 16th, 2022. Again, the graphic starts with a lot of white counties and light yellow counties representing 0 to 1 to 2 deaths in these facilities. And as the graphic moves on, if the graphic moves on, you'll see cases go to, nice, good job. In some counties, cases or deaths rise to 13 to 30 deaths per county. And this is over the Omicron variant, Omicron. Yeah, I'd be happy to answer questions about these at the end, but I'm going to pass it back to Lily now. Thanks.
Yeah, thank you, Arin. So this is one of the ways in which we've been able to help support some service providers and activists in state and national advocacy efforts. We were able to, I say we, but some centers for independent living, I think in Pennsylvania and Colorado, we also did some maps for those states, really communicated state level disproportionate impact to secure funding streams for emergency transitions pilot programs to support CILs in doing some emergency relocation and transition during the pandemic. Really increased community awareness of the pandemic's effect on congregate settings, and hopefully, support and build support for access to home and community-based services and housing needs. It was used also to show the necessity of accessing state-funded housing vouchers for emergency transitions from congregate settings, communicated state-level disproportionate impact to advocate for federal emergency funding to be used for transitions and relocations out of facilities. And that was specifically with the Pennsylvania Emergency Management Authority and the Federal Emergency Management Authority, if I'm doing that. We were also able to present some of this information to the Center for Independent Living presented this information to the National Council on Disability. And then really in doing this, we've also identified, I want to say I learned, and I should get this numbers, but the CIL that used this data in Colorado was able to, as a direct result of these powerful data and the state level maps, were able to secure funding to transition, I think, like 19 more folks. So it resulted in some real tangible change for those people. But throughout this, we've identified major data limitations and discrepancies, right? So we have seen disparities between CDC, CMS, and state data, disability numbers, and really question some of the trustworthiness and data level, like the levels of data accuracy. Are people reporting? And if this data set is dependent on individual facilities to report. And while there are measures for quality control, it just doesn't, you know, we question them. It's a lot of data. And there are some real questions. There's also a lot of inconsistency between the types of congregate settings that are being captured. And so what people notice is that their state level, like public health departments, if they're reporting on congregate settings, will often have much higher numbers actually and more facilities than the CMS data. And that's mostly because this is only representing facilities that accept Medicare, Medicaid, and just don't capture everything. So that's challenging because, of course, this is a national level. So if we want to look at this at the national level, this is kind of our best bet because states count and collect this data differently across a bunch of, 51 plus different departments, and some don't collect at all. So in some ways it's, maybe it's the best data that we have, but it's kind of bad. And so we want to start asking questions about why is that? Why isn't it better? How could it be better? So really, I guess I'm going to stop. I want to really open it up to some questions and discussion and have thinking, ask you all to think about, how does your center, your organization use data for advocacy? What gaps or challenges have you encountered when trying to advocate for the needs of the communities that you serve? And what barriers have you experienced in using data for advocacy? This really touches on, oh geez, sorry, I just turned off my volume, I think. Can you hear me? Okay.
We can hear you.
Great. Or I turned off you for the questions. I don't know what I did. That some of these data sets are really difficult to use, right? And it may be that folks working at a Center for Independent Living or another state organization don't have the capacity to access and utilize that. So part of what this network is for is we want to bring people who have some of the skills and experience and also the same interest together to help provide that kind of, I guess it's like peer support. It's peer support for advocacy for people who care about this and want to benefit each other. And then I have this other question here around what are the risks associated with using data? And that is because sometimes if you're using bad data, you could end up doing harm. And is there concern around that as we start to think about and measure and count disability and how we do that and how we ask those questions? And are we potentially, making more vulnerable populations, although I don't like using that term, more at risk, right? And so kind of what are some of those questions and concerns? And I'd love to open it up. Yeah, so I have a question here right now that I'll read out loud and then answer. And then if folks want to raise their hand or something, I think Alex can unmute them or something. But we have Susan here asks, with disparities in reported numbers, have you been able to feel confident that your numbers are verifiable? If ILCs use with legislators who ask where we got the numbers. For decades, we've asked various state government agencies for numbers and haven't been able to get them, like how many people are in various congregate settings. Yeah, I think that's an excellent question. I feel confident, I think we feel confident enough in that they are numbers that are reported by CMS, right? So they aren't numbers that we're collecting. It's probably how confident are local legislators in CMS numbers. I think they're less likely to question the data, to be honest, than maybe we are, or Arin and I are. And I think the way to think about these data is that, in fact, these represent an undercount. So 100% there have been more deaths and more cases, right? We don't know how many, but we feel as confident as possible probably in these, but really know that they're probably it's probably an undercount. We have this also with, there are a set of, and that's one thing that DisDATA is hoping to do, is we're working on kind of a data repository, I guess, or guide, where we can put out information about where disability data is, particularly at the federal level, but maybe some can help provide guidance at the state level. What the questions are, and maybe some of those questions around accuracy and reliability. So some data sets, right, like they may not be good, but they're the best that we have. And so we can use those numbers, but then if that's the best we have, what are the questions that we have, or how can we advocate to make it better? And that's where this group will hopefully, where I'm really hoping that we'll be able to really push for a change at that level and say, these data aren't good enough. Like maybe, represents that there hasn't been as much effort or interest in protecting disabled lives, particularly in congregate settings.
Can I just add to that quick? This is Arin again. It is kind of interesting though, because as Lillie said, we think it's an undercount, but it's the best we have. So it's something we can use, which does get us somewhere, right? But it's kind of interesting to look at. Some CMS facilities exist but don't report. It's kind of on them to do the reporting. And when we look at the facilities that don't report, there's something like 320 facilities that don't report, and something like 277 of them are in Texas. So that kind of gives us an avenue to kind of look into or to advocate for, because knowing that is something to go off of, I guess. It's kind of interesting that way.
Yeah, exactly. And I think that's what we're here to, like, we want to invite all of you to join the network. You can email your interest to the email that's on the screen here, DisDATA, DisDATA at mso.umt.edu. Just say, hey, I want to join, I want to learn more. We can share and send all sorts of stuff. We'll send this PowerPoint hopefully out. So and we can maybe send a citation or some information about the data if you want to use those maps that Arin pulled together. We want you to use them. That's why they're there. That's why we've made them. We really just want to learn, like, what have been those challenges? What have you ever been like, well, we have a program and I really want to promote it, or we know there's this need and I'm looking for data and I can't find it. And those are the questions we want to know. So right now, the group is really focusing on institutional bias and congregate setting bias, and trying to identify data that can highlight systems that support systems and policies and practices that really support or funnel people into congregate settings, and try to really do some research around what data is out there that illustrates this, or is there outcome data? There's not a ton, right, of what are people's outcomes, right? What do they look like different in the community versus in an institution? But also, like, again, community-based housing data around, and personal assistance services, how many people need, receive, use. A lot of the stuff can get really hard because it's not available at the federal level. It exists across these different state systems, and there may be some room for advocacy of saying, like, this is untenable, right? Or if there are states that do a really great job and we'd want to really lift up, and that have really shown how data can make a difference. So yeah, here we have a question. Is it true there's no way to tell what variant who come down with COVID actually have? Is it actually just what most popular variant and what is put in the books? Yeah, and we should clarify, I think. Thanks, Crystal. That's a really good question. We should probably clarify that the data, we are calling it we are saying these represent maybe Omicron or Delta, but it's really just representing a time frame in which we've seen, like, different COVID variants surge. So we cannot tell what strain any of any of these necessarily are, but what we can do is say, well, we know a lot more people are getting sick right now, and we're able to kind of map and show that like people still are getting sick and dying in nursing facilities, even though we have a vaccine, regardless of whether one variant is more severe or less, people are still dying. And I think that kind of we're not hearing as much about it, I guess, as we were earlier on. And we also have vaccination rates in facilities. So we have staff and resident vaccination rates by facilities. So there are some tools also that CMS provides and that we can also do to look up specific facilities and identify vaccination rates for those facilities. And so there's some potentially really targeted local level advocacy that can be done in that regard, to really dig into what's going on. You know, I think nationally we're up to 84% of staff or something are vaccinated, but that looks really different across the country, and not every facility is like that. And so some questions we've wondered, like, right, are places with lower vaccine rates also places where we're seeing outbreaks and increased deaths? All right, Colleen has a good question. Not a COVID question. I'd like to get data on my congresspeople bill supported, any data on their advocacy history and committee assignments. Not sure if you deal with this, but important. Also how to break down budgets. Yeah, that's a really, budgets like state and federal, state to county, and funding history. And that is actually something we haven't talked about with within the group, but I think I think there are a lot of folks who would agree and think that that was really interesting. And we've done some maps at the congressional district level. And that could be also really an interesting thing to overlay, like with facilities that are located in congressional districts. But I know that for sure that is public, but that could be a good example of where some advocacy, where I imagine it might be hard to find. And so that's, you know, definitely a strategy, whereas where data may be required federally or nationally to be public, but is really difficult to access. And so that's really a good point in deciphering some of that.
This might not be what you're looking for, but a good resource for kind of voting history, votesmart.org. It has pretty much any elected official you could want, and you can look them up, and they do a little bio and yeah, voting history and kind of stances. So yeah, that's all I know.
That's a good resource. And that's where this is like, I guess what I want to say is what we have is right now. Oh, and Brad, I see in the chat, Brad has a question. Do you have anything on the voting trend of people with disabilities per state? So this is like, I want to just clarify, this is like rates of like civic participation, or like rates, the rate to which people with disabilities vote from place to place. I just want to clarify. And that's a really good question. So I guess mostly what I want to say is Arin and I probably can't answer all of these questions. And while we know some data really well, because that's our area of expertise, the reason why we have this network is that we all have various levels of expertise. Yeah, and clarify all voting trends, barriers, and participation. Yeah, and I think this is an example of an excellent question that if you're interested in just joining the group does not mean you have to participate to, and you would participate to the extent that you want, really. It's right now we're kind of functioning as a listserv. We also have a Discord account for folks who use the platform Discord as a way to ask these questions of each other. And so we have researchers, but we also have advocates. We have people who might have gone down some of these paths before and have some resources to share. And I think what we're hoping is that out of this group, we could even develop smaller groups of people with shared interests to really dig into, say, voting, I think, and participation, and even accessibility. And so I think what we're hoping is that this network continues to grow, and we bring in as many people from as many different backgrounds as possible to just join and pay attention and read some emails when they come across your inbox. And if something catches your eye, connect with someone, right? Or then you could reach out to us and say, hey, do you know anyone who has this background or might be someone I could talk to? And we're trying to facilitate right now. It's super loose. We don't really have a great system, but we'd love to be able to develop a system where we can get people in connection with each other. And so this is just some example of like how Arin and I have been able to like harness our interest in geography and mapping to visualize some of this data in an effective way. But we have like graphic designers, and we have lots of advocates. We have lots of people who are interested in emergency management and emergency preparedness with a lot of good background and expertise in that. So I just really encourage everyone to send an email to disdata@mso.umt.edu. I said that really fast for the interpreter. And join us. So I guess it's an invitation, and also want to leave this open for some more questions if anyone has it. Yeah, here, Susan, I see another that NYSILC, the New York State Independent Living Council, has tried for so many years to get numbers in order to advocate services for underserved people in the state, and getting accurate numbers has never been possible. And that is I think something that's what we want to start to document, right? Like, how have those numbers been, you know, what has been missing, right? And like, are other people across other states experiencing that same thing? And is there some, you know, how can we come together to support each other in that and think about ways to push for change? Yeah, and then Crystal talks about staffing with CNAs at facilities, moving from one facility to another, and like issues with PPE. And this is a particularly in rural areas. We do work with this and have seen this. I think this is a good example of actually how the disability advocacy that we're doing intersects with a lot of different advocacy issues. And when we talk about building solidarity, it means also looking at economic barriers, looking at the marginalized communities that primarily work as CNAs and work in those fields, and what are the avenues and strategies to improve and work on that. So something that has come up repeatedly in our institutional congregate setting bias group is trying to identify and maybe do some research around the fact that like personal care attendants and workers get paid less to work often in the community than they do in a facility. And so it's an excellent example of how we reinforce a system that is dangerous and deadly to people living in facilities, whereas we could advocate for change. And who knows what we're going to see coming down federally from that, but it'll be really interesting too to see and hopefully be able to track some of that. Yeah, Colleen also has a question. I'd like to know what funds come from infrastructure to advocate to use for accessibility. So yeah, that would be really, I think there's some really interesting, we need some economists is what I guess. We need some economists in our team. So if you know any economists, send them our way to start doing some budget analysis. That would be fascinating. And I think also probably to identify the ways in which these data are inaccessible, in the fact that we have systems probably that funnel money from the feds to the state, and that looks different from state to state potentially, and how that then gets distributed. And of course, infrastructure money isn't always federal. Of course, it's also at the state level. And so you'd be dealing with state and federal data management systems. And so I think I'm hoping one thing that we'll be able to come from our group is some policy recommendations, also some data recommendations around what are equitable, like best practices in terms of, like, if you want to build a more equitable system for making data accessible, what are the strategies to do that? What can you start advocating at the state level in order to do that? Because as soon as you start, it's easy when you hit these barriers to say, oh, well, I can't get it, or I don't know how to do it. And we're hoping to have a group of people that says, well, why can't you get it? That's a problem. We need to start saying that that's a problem and advocating for change in that way. Anything else?
Oh, I was going to ask a question, Lillie. So I know you mentioned that there are people with kind of technical experience. So if we had an advocate at one of our centers here, who wanted to work on an issue, say housing, and how much accessible housing was available in their area, they would be able to connect with people in this group and kind of get tips on how to do the survey design, how to get a statistically, relevant amount of data. Like, there would be people to help them get through that process, right? And maybe eventually create their own local map or resource, right?
Yeah, I think so. I mean, I think right now I have to be fully honest, a little underrepresented in some of the research field. We have folks there, but I do think that's something that Arin and I are also committed to helping facilitate those interactions. So I think, like, what is the conduit to someone who would know that? And so that's what we would hope that can come out of this. It's hard to say, honestly, right now, because we're new. We're really, like, we're not funded, right? We're just people doing this. But yeah, and we have definitely a lot of people who have a lot of resources to share in that. It's always hard to know, like, how much time someone might have to be able to provide in-depth technical support, but we do have a lot of resources across all of the people. There are a lot of tools and strategies that we can share that can help support in that. And I'm sure, yeah, part of it too is, like, another center gone down that road, right? So we have representatives from both April and NYAIL who join periodically or are interested, that can also help connect centers with other centers. And so this is just another way of really trying to build and strengthen some of these center and research partnerships. So thanks, Alex. Yeah, and thanks, Crystal. Again, talking about just the low wages of PCAs. My PCA who cares for me in my home in New York State makes $13.20 per hour. My life is in his hands every day. If it wasn't for him, I'd definitely be in a nursing facility. And so a huge part of this too, I think this idea of working in solidarity is really shifting and valuing and recognizing the value of that community care work that people do, that we so clearly undervalue, and working to change and gathering data. So we have some stuff on that too, and have connections with if people are interested in that kind of research and research around, like, specifically personal care workforce, we have a relationship with a research center in California. And that is a way that we can start doing this, is we can start connecting people to some of these other research centers that are, like, the experts in understanding that kind of data. And so want to be able to start facilitating that.
So I had another question, Lillie. So we just finished a census, a US census recently. So is that something that people in this group are interested about? Has there been talk about, new and exciting things that are going to be happening soon with that?
Yeah. Well, Arin and I are definitely excited about it because we do a lot of work with census data, specifically data, it's not exactly the census, but from the American Community Survey, it's connected to the census. And there have, I think we sometimes get caught up in that people don't always love the measures that are used in that by the census or by the American Community Survey to measure disability. And I think there are a lot of concerns about data quality. And so the census is struggling a little right now to understand the impact of the pandemic that the pandemic had on the quality of the data. And so Arin probably knows a little bit more, and we can share resources out on that if people are interested.
Yeah, this is Arin. I'm not sure if excited is the right word. I'm kind of more apprehensive,
Yeah,
worried than anything. We attended an ACS, the American Community Survey releases data every year. It's similar to the census, but every year. Times a survey, but they had hosted a meeting talking about pushing back their release dates because of the impacts COVID has had on it. And so that's kind of been on our minds. And then, yeah, new stuff keeps coming out about kind of some issues that the last census had that we keep hearing about. So yeah, I don't know. I'm curious to see what it'll be like.
we do have a tool. Arin, would you maybe send out in the chat a link to disability counts? Because this has been one of the things that the RTC rural specifically has created, because we recognize just that data access has been challenging for folks. And for a long time, the previous tool that the census released was not screen reader accessible to access and download data. So we developed a disability data lookup tool that is accessible, that folks can use to access data specifically at the county level, because we focus on rural in our research world. We often look at things at the county level. And so we've pulled in all of the different disability variables and disability measures, or most of them, that the American Community Census survey as part of the US Census has releases on disability, and you can click your state and then click counties, maybe that your Center for Independent Living serves, for example, and then download a data set that has information about disability and employment, disability type, disability by race and ethnicity, and poverty status, veteran status, employment status, and can download that in a Excel file, and we're happy to provide any and all technical assistance in using that tool, and just really want to make the data as accessible to advocates as possible. So I think that's probably in the chat now. Really encourage you to use that. We also have maps. We have a bunch of other maps. So we have these maps that we made around COVID, but we also have maps then of all of that disability data mapped at the county level. And so there are maps for New York. The data is slightly older, but it's still really, it hasn't changed a ton because of the way that the data is collected. We don't see a ton of change. And you can get that for like people with disabilities living in poverty and employment, and you can get all of that at state level maps that you're free to, download, use in any way that you want. They're kind of image files. Yeah, thanks, Crystal. The census doesn't really focus on people with disabilities, and they could ask more questions. And there are some surveys that ask federal surveys that ask many more questions. And that's part of what we're hoping, like, we can kind of increase awareness of. The challenge of those surveys is often that they are not available at like local levels, right? So you don't get information about your local community. You can often get stuff maybe at the state level, but also very rarely at the county level. So we have some resources that we can share if folks are interested in like what surveys do exist that are out there. The PNA, the National Disability Rights Network, I think I just got that. I think that's the right like the right organization just released a really great report about disability in federal data sets that we'd be happy to also share. Yeah. Arin, I don't know if you can find that in and link it any chance. Well, we can send it out with our PowerPoint too. So many resources. This is what we want to do, is we want to provide you with as many resources as possible to help you in your work.
Yes, once we get this recording up on our webpage, we can put these links on there for everyone.
Great. Well, I don't know if anyone has any more questions, or yeah, we'll share out everything and put links up to all of this stuff. Please join our group. We try to meet semi-regularly. People can join or not, send out lots of emails, lots of potential connections, lots of opportunities to advocate, particularly at the federal level, for meetings to join. And we have some templates too, or we have some statements and language that we also really encourage folks to use if they find any of the language appealing around some of this data, around data equity, and want to integrate it. It's there. Everything is just, we have a shared Google folder that basically we want everyone to access and take stuff from.
We also encourage new members to take this survey, this kind of connection forum survey, and we've kind of built this little database of people and their contact information and what they do and what their interests are. So you don't necessarily need to attend a meeting to find people to connect with.
Exactly, yeah. And we're still in the process, full disclosure, we're still in the process of building this up and figuring out what's the most accessible way to do it. How is it that this group wants to move forward? We're trying to be as collaborative and inclusive as possible. So sometimes that takes time, and we are here and want to take that time and find a way to balance like urgency and advocacy, and also time to really build a group of people that care and want to work together and feel valued.
If there aren't any more questions, we could probably wrap this up. Okay, well, thank you so much, Lillie and Arin. It's really great to hear what you've been up to, and certainly invite all our advocates here in New York to join you and be a part of this. It's really exciting that this is moving forward. So thank you all so much. We will be working on getting a recording out for this, and of course the links and the presentation from Lillie and Arin, and encourage you to share that as well with people in your networks and get the word out. Thank you, everyone.
Thank you. Thanks so much for having us. It's great. We hope to see lots of emails and people interested. All right. Have a good afternoon, everyone.
Thank you to our 2022 webinar series sponsor, Waymo. Waymo is an autonomous driving technology company with a mission to make it safe and easy for people and things to get where they're going. We believe that fully autonomous technology holds the promise to improve road safety and offer new mobility options to millions of people. This is why we're designing Waymo Driver, our autonomous technology to give people a new kind of freedom to go where they want, when they want, while making the frustrations and concerns with driving a thing of the past. Logo fades into view. New York Association on Independent Living.